My name is Sarah Harrigan. I am the Long-Term Services and Supports Administrator at Department of Human Services. We oversee eligibility for long-term services and supports. I saw in some of our comments earlier today, there were some questions about what are the options for paying for long-term services and supports. And I'm here to talk about Medicaid and the Medicaid option. I am going to share a presentation that I have for you. All right. So today we don't have a ton of time, so I just wanted to talk about three really important questions. What is Medicaid LTSS? Who is eligible? And how do we apply? So to start with, LTSS, like I mentioned, it stands for Long-Term Services and Supports. It really is a spectrum of services covered by the Medicaid program. It is Medicaid plus this wraparound of long-term services and supports. It is to assist people who have chronic or disabling conditions and that really need assistance with some of the activities of daily living. So that is eating, bathing, dressing, moving from one location to another, going to the bathroom, moving around, walking around. For folks who need assistance with that, this is what LTSS provides help with. The specific types of services, so there's really a wide variety and is based on a review of your needs and functional assessments, as well as review of clinical documents. We'll talk a little bit more about that process momentarily. But some of the services include having an agency provide CNA services in your home, providing special medical equipment, some modifications to your home, such as ramps. Those things can be covered if you are eligible for Medicaid LTSS. Additionally, on the higher acuity level, LTSS is the Medicaid LTSS is the primary one of the primary ways that skilled nursing care is paid for. If you or a loved one do need to go into a nursing facility and determine that that is the best choice, LTSS Medicaid can help pay for that. But there's also a spectrum of services for folks who do want to stay in their home and age in place, a variety of ways that you can get the assistance that you need. So who is eligible and what does that process look like? So to start with, LTSS, it is Medicaid. So there is a review of finances, but more importantly, there's a review of your clinical need. So all applicants are going to be asked to submit specific medical documents. One of the documents is something that is reviewed and signed off on by your primary care physician. And these are reviewed by nurses at the state of Rhode Island to determine that a clinical level of need is met. And in addition to these medical documents, if you are seeking services in the home, you will also receive an assessment by a social worker who will really help talk about what your goals and what your challenges are and help provide additional information to what the physician is providing. In terms of financial eligibility, there's not a very strict income limit. I'll talk about that more. There is, if you are making more than $9,000 per month, you are not eligible. Most people do not meet that. What happens in most cases is that we do ask you to provide or contribute to your cost of care. So as we go through LTSS eligibility, one of the things that we determine is how much the state will ask you to pay to contribute towards your care. There is a very strict asset limit. Assets must be under $4,000, and that is your checking accounts, your savings accounts. We do review trusts and other assets such as a secondary home or secondary vehicle are considered assets, and that asset limit is $4,000. One other important item I will touch on a little bit more is that if there is a married couple and one individual is seeking eligibility for LTSS, the income and assets of the spouse are reviewed as well. There are definitely special considerations provided. We are not asking the spouse to contribute everything to that individual, the other spouse's cost of care, but that is part of the eligibility process. So some important considerations. I really wanted to highlight these 3 items because these are the most frequent questions that we receive when you're considering your eligibility for LTSS, Medicaid LTSS, and if this is the right path for you. I mentioned real estate, a second home. If you are receiving care in a nursing facility and you are not planning on returning home, the state does ask you to sign a waiver, realizing that the state may place a lien on your probate estate. If people are a disabled child or a spouse is still living in that home, that lien is definitely not enacted. But we do want people to know up front that real estate is considered an asset when you are applying for Medicaid LTSS. Another component, which is really different for folks who have applied for Medicaid or a SNAP food benefit program, any other benefits, is LTSS does a full 5-year financial review. The reason for this full 5-year review, and we do use electronic verification of banking records, we review assets for 5 years to see if there has been a major transfer of resources. These transfers may disqualify folks for a certain period of time if there was a transfer of funds for something that was less than fair market value. So if you sell your home, but at much less than fair market value, the difference between the fair market value and what you sell it for, we would look at that for possibly a disqualifying transfer. There are pages and pages of regulations on this, and if this is something that comes up during eligibility, it's certainly something that you can talk to an eligibility specialist about. But again, we do want to flag up front that this is part of the process for eligibility. And then finally, cost of care. I had mentioned this previously, but this is a big part of our conversation with folks who are applying. When you apply for long-term services and supports, you provide information about your income. And we take from your income, subtract living expenses, a personal needs allowance, expenses that you might have based on if you have a spouse in the community, any additional Medicaid or healthcare premiums that you are paying. But the remainder, a lot of folks do have a remainder, and that is what we would consider your cost of care that we ask you to provide to your provider, your nursing home, your assisted living, your home care provider on a monthly basis in order to keep eligibility for long-term care Medicaid. So how do we apply? This is where I did want to spend some time today because I know a lot of folks have questions about the application process. There's 2 ways. You can apply online or you can apply using paper documents and mailing that in. Online, you can apply at healthyroad.ri.gov, and you're going to want to apply for health and human service programs. So this right here is where you're going to get the application that you'll need to get LTSS Medicaid. Applying for health coverage does not get you to all of the questions needed for long-term services and supports. A lot of folks find that they do need some additional assistance in the application process. So you can find all of the supplemental documents on the website. This is a long website. I apologize for that. If you do use Google to identify it, you can search for Rhode Island LTSS application, and this site does come up. We'll say we're also in the middle of doing a review of our websites to make sure that they are much more user-friendly. But all of those materials are online. If you do find that you need assistance, there is assistance available to you. So the Point is a agency that can help make sure that you understand what options are available for long-term services and supports. They can talk to you about both your Medicare coverage and your application for Medicaid coverage. And they can be reached at 462-4444 or at 211. This is a great resource for questions that you have about LTSS. They may get you in touch with a specific agency who can help you walk through that application process. Additionally, you can always call Department of Human Services. So we have a hotline that we do pick up daily between 8:30 and 3:30. You can contact us at 415-8455. You can call and ask for an application packet to be mailed out, or you can call and ask questions that you may have about your application and application process. And again, the DHS direct number is 415-8455. DHS does have 6 field offices. Right now, due to COVID-19, they are closed to the public. So we are doing all of our customer service via this phone model. So that is the best number for you to call. 415-8455, and you can be connected with a LTSS eligibility specialist. So what do I need to apply? Unfortunately, this is a program that requires an awful lot of documentation. The first step is the DHS-2. This is the application for assistance. This is the Department of Human Service application for assistance, and you can see here that it is a single application for all of our benefit programs. You are going to want to make sure that you choose LTSS, Medicaid Long-Term Services and Supports. On this application, it is about 40 pages. It does have some questions, many questions you will not need to answer because they are specific to other programs. So always look at the question, make sure it says LTSS next to the question. If it says LTSS, that is something that we need you to answer. And we do ask you questions about your income, about your bank accounts, about any supplemental insurance that you might have, and also if you have a spouse and spousal information. There is supplemental documents that are required in addition to that application. And again, this is why a lot of folks find it really useful to either call the Point or call DHS and get some assistance and guidance in filling out this application. We're happy to help. You can find all of the documentation, like I said, on the Executive Office of Health and Human Service website. We are continuously really working to improve our customer-facing websites and make sure that they're as easy to find and as easy to use as possible. I want to just touch on a few documents that are required and why. So the cover sheet, right here, there's an application assistance cover sheet. I'll show you a picture of it. This is kind of what it looks like. It's 1 page. We really recommend filling this out and putting it on top of your application if you're using a paper application, because it really helps us identify if you know already what service you're looking for. If you know that you are entering a nursing home and you're seeking nursing eligibility to cover your nursing home stay. If you know that you're looking for a self-directed model, you have a loved one that wants to be providing that service for you, and there you are seeking Medicaid eligibility so that individual can get paid to provide those services. That is really helpful information for us to have up front. It can help the eligibility process go really a lot faster. We also have a couple of documents here, the DHS 25 and 25M. These are disclosure releases. The first one, DHS 25M for medical, that allows a release of health information. And like I had said earlier, clinical eligibility is an important component of this program. If you sign this form and fill it out, it allows us to understand which providers we can communicate with. So if you are in a nursing facility or an assisted living facility, it is really helpful for you as well if we can communicate directly with that business office and receive some of your clinical documentation directly from them. The DHS 25 lets us know who we can talk to about your application. So if there is, oftentimes there's a son or a daughter, a guardian, or sometimes it's your provider themselves, that you say, it's okay. DHS can talk directly to these folks about the application status and what's needed. That is really important for us to have. And again, it can really help move the application process a little bit faster if we know who else we can talk to really help move the application through. There is a document, it's called the CP12. This is just a notification of recipient choice. This is important for us to have because we do want to make sure if you have gotten to the point of filling out an application and you are saying that you want services in one specific setting, we want to make sure that a conversation has been had, that you understand that you do have choice in your setting, that there are opportunities for you to stay at home or to move to an assisted living facility or a nursing home care. There's a variety of setting options. And then finally, last but not least, regardless of what setting you are receiving LTSS services in, you will need a form called PM1. This is a medical form that your primary care physician, usually it's a primary care physician, will fill out on your behalf. So this is the cover sheet. Again, I just wanted to show this. I could spend an hour talking to you about all of the different services and different programs within LTSS. But I did want to just take a second to highlight these are where some people choose to receive their services: in a nursing home, in an assisted living resident, in somebody else's home who will be assisting and taking care of you. These are kind of key indicators that we look at to help move your application as quickly as possible. Few tips before I open this up for questions. I have mentioned previously, spousal information is really important. This is often where we find we stop the eligibility process to call a client or to ask for more information. If you are married, we want to be able to take your spouse's information into account, and also their financial needs into account as well in determining that cost of care. So your spouse's information is really important, including their date of birth and their social security number. That should be on the application, whether you're applying online or on a form. And again, listing any income that they have, any asset information that they have is very important to making sure that we get the correct cost of care. Please make sure you sign each page. If an application is not signed, it does get sent back. So it takes some work to put together all of this information. We really want it to go as smoothly as possible. So please take the time to make sure that the signatures are on there. Keep a copy for your personal records. I really do recommend that. It can be very, very helpful to have your own copy on hand with you or a loved one or a trusted provider. And then the time frame. So LTSS eligibility should be determined within 90 days. Our average right now for most applications is about a little over 2 months. It's about 65 days for most applications. Some applications, especially those with complex financial information, so there are trusts, there are intentional transfers of assets to become eligible for Medicaid. These do tend to take longer, and we currently do still have a backlog. We've got about 150 cases that are currently pending over 90 days. That is a lot lower than some numbers that we have had previously, but I do want to make sure that folks are aware of the time frame and the fact that because there is a clinical eligibility review and a financial review, the eligibility does take longer than eligibility for other services through the state. So one more slide, and then we can turn it over to questions. I think that we do have a lot coming in. The last thing that I really wanted to share, and I do get this question a lot, especially from advocates in the community, what happens once I submit a paper application? What happens in those 90 days? So this is a kind of a high-level overview, but I wanted to make sure that we were shedding some light on what the actual process is and what might be happening with an application once it is submitted. So it's entered into Bridges is what we call our eligibility system. An application is submitted. If it's in paper, it does get scanned right away within the first day into our eligibility system, and all of the supporting documents are organized and submitted into that system as well. The next step, within the first 30 days, hopefully significantly less than that, we do an initial review of the application. We enter all of the data into our system. We do an initial financial review. We send a request to an electronic asset verification system to do that full 5-year review, so that you don't have to send 5 years worth of bank statements in with your application. At the same time, assuming that we have all of the medical documentation that we need, we are sending this to our nursing unit for a medical review. So the initial review will check for completion. It will send a request, or we'll give you a call if we need any additional information. And then we're sending it for a clinical review at the same time. If you are receiving services in your home, we will need to set up a time for a functional assessment. Right now, those are still happening over the phone. Historically, it's definitely been an in-person visit, but due to COVID, we want to make sure that everyone stays safe, and we are setting those up over the phone. After we have all of that information, we've found you eligible financially and from a clinical perspective, that's when we do the cost of care and identify how much of your income we'll be asking you to pay towards your services. Then we authorize. You will receive a lengthy notice in the mail that provides details on eligibility and time frame and the cost of care. And that's when we send in, and this is especially for our community partners, we send information to any partner agency that may be assisting you, and the eligibility information is sent to our billing system so that providers can start billing. So with that, I want to say thank you very much for taking the time. I will leave this line up for a little bit. Or this slide up for those of you who want to take down the phone number or my email address. And I am happy to answer any questions if you have some.
Oh, the questions are coming in, just like I expected.
Absolutely.
So,
happy to answer some. If you can help me keep an eye on them, I wasn't able to keep track of.
Yeah, no, that's great. So Ben actually had a question. How soon after Medicaid is approved would you know if there was a lien on the primary property?
Well, the lien does not happen right away, and the lien does not happen until the estate is in probate.
Okay, that's great. And so one of the things when you're qualifying, this is a pre-submitted question, when you're applying for Medicaid, are there certain expenses that reduce what your income is? So if you had to say pay out of pocket to renovate your bathroom so that you could get your wheelchair in.
Absolutely. So we call this spending down assets. And there's most ways that you spend down your assets are qualifying ways. One recommendation that a lot of folks have is prepaid funeral expenses. But also, if you're spending money on your home, on your taxes, that's not going to count against you when we are doing financial eligibility. What we do look at is transfers of sums of money that you're selling something for below the fair market value, or you're giving either money or assets away. That is when we would look into whether there was a disqualifying transfer. And potentially put in place a period of time where you would be eligible but for the transfer, and we would kind of pend what we were able to pay for a certain period of time. But other expenses that would reduce your income are definitely anything related to healthcare. So your health insurance premiums, if you are paying out of pocket for medication, unpaid medical bills, anything that is unpaid up to 3 months prior to the point of eligibility, submit that with your application. We can review that.
Awesome. So I'm going to ask a question that was actually submitted to the Lieutenant Governor that I think you might also be able to give more information on. Can the state subsidy for the copay funding be increased, allowing agencies to offer home health aides a more competitive wage? And can the independent provider program be expanded to include copay eligible seniors?
Those are two great questions. So the first question is about the copay program. The copay program, I'm not sure if you've had someone on talking about that. Sometimes because of the high cost of care, or for whatever reason, LTSS Medicaid is not the best way to go. We do have a great program through Office of Healthy Aging that allows you to pay a reduced price for home care services. So that is the copay program. Was the question, can the rate be increased or the income be increased?
The rate.
The rate be increased. I can definitely bring that back to the Office of Healthy Aging as a recommendation to look into. I don't know off the top of my head when the last time that was updated, but we can certainly bring that back.
So Shannon Crow brings up a really good point, and it's something that we're seeing really across the state. It's kind of long to bring on the screen, so I'm just going to read it. She said, once an applicant is approved for long-term care, are they able to contract with a home care agency of their choice? She finds that many of her residents have approved long-term services and supports, but are not receiving home care due to the CNA shortages. She tells them to call the Office for Long-Term Services and Supports in Cranston and speak with the case manager. They get feedback that they've taken this step, but then they still aren't getting the help that they need.
Yeah, that's a great question. So the answer in short is yes, you do have choice over which agency provides your care. However, the agency, if the payer is Medicaid, the agency has to be willing to accept Medicaid. Our caseworkers do work with all of the Medicaid providers to really work on getting hours filled and getting people the care that they need. There is a shortage of CNAs working in home health agencies, and we find that especially in certain pockets of the state, we have a very, very hard time making sure that folks are connected with an agency that can serve this. There are a couple of other options, and I would encourage folks in this scenario to really look at the self-directed options. The independent provider is a model where you identify a friend or a family member, or we help really put you in touch with someone who is an independent provider. They are not a licensed CNA necessarily, but they are someone that you decide you trust to help you with the goals that you have, be it you need help bathing a few times a week, or you need someone really helping you with meal preparation. Whatever those items are, if there is someone in your life who is doing that for you or is willing to do that for you, if they were able to be supported and receive a wage for doing that work, that is, you can really look into the IP program for that independent provider. There are other models of self-directed. So shared living is if you are living in another individual's home and that person is taking on the responsibility of caring. And then personal choice is a third model where you are not necessarily living in someone's home, but you receive your own budget through Medicaid, and you use that budget to pay directly for CNA. It could be through an agency, or it could be paying directly privately a CNA or another care provider to assist with your needs.
Awesome. So there is a question from Elizabeth Bodie. She wanted to know if you could go over the 25M and the 25. They can be confusing.
Yeah.
We're kind of
Sure.
butting against some time limits here.
Sure.
So
Sure.
I'm wondering if that's something you might be able to answer, and then I can reply to Elizabeth later, or if you can go in, she's right in the Facebook feed, and answer that question, if that might be possible.
Absolutely. So,
Excellent.
Elizabeth, those are the 25 is to be able to communicate about the financial information on the application and the application process. The 25M is specific to medical information.
Okay, that's good. I think that this was so very helpful. There is just one really, hopefully, quick question. If somebody is in the community and they're receiving long-term services and supports, and unfortunately they're no longer able to remain in the community, and they need to go into the nursing home and remain in the nursing home, does that approval transfer with them into the nursing home, or do they need to redo the paperwork?
That's a great question. They need to apply for a program transition. So we have a one-page form that's called a program change form. It can be submitted for a financial change or because there's a change in need and you need to move your setting. What would need to happen at that point is we'd need to do another clinical review, but we would not need to do another full financial review.
Awesome. This has really been amazingly helpful today, Sarah. And I might actually have you come back on another time to talk even more about this, because I know that this is something that a lot of people really struggle with and feel that, you know, they really need to hire an attorney to do this and get very overwhelmed with it. So I am so appreciative that you were able to come in and speak today.
Well, thank you so much for having me. I welcome those opportunities to shed light on this. I know it's a confusing process, and I'm really happy to help in as many places as possible.
Awesome. Thank you so much, Sarah.
Thank you.